Have you noticed that breakouts appear not just anywhere, but in the same places? On the chin, again and again. Or on the cheeks, always there. Or this combination, the lower part of the face, as if traced from a template. This isn't a coincidence. As a dermatologist, today I'll explain why the breakout zone matters, what different areas of the face say about processes inside the body, and how to understand what specifically is worth addressing first. Let me start with something many people will surely recognize. You wash your face every day. You watch your diet, drink water, try not to touch your face with your hands. Maybe you've already tried several products. Something works a little, something doesn't work at all. And the breakouts keep appearing. Right there. On the chin again. On the cheek again. As if there's some spot that your skin likes for inflammation. And this is where a question arises. Not how to get rid of it, but exactly why there. Why not on the forehead? Not on the nose, but specifically the chin? Why the cheeks? Specifically the left or specifically the right? This isn't a cosmetic question anymore. It's a question about what's happening inside. The answer exists. And it's more interesting than it seems. There's a concept in dermatology called facial zone mapping. Its roots go back to Eastern medicine, but modern dermatology hasn't dismissed it. On the contrary, a number of its connections align well with physiology. The idea is simple. Different zones of the face receive innervation and blood supply from different systems. Lymphatic pathways, nerve fibers, and hormonal receptors are distributed unevenly across the face. That's why systemic changes in the body can produce targeted breakouts, not scattered randomly, but precisely where they're reflected first. The chin and lower jawline, the hormonal zone. This is the best-known pattern confirmed by endocrinology. The sebaceous glands in this area are especially rich in androgen receptors. A small hormonal spike that the skin wouldn't notice in another zone produces a visible reaction here. In women, this is classically linked to the menstrual cycle. A few days before menstruation, estrogen levels drop, the relative influence of androgens increases, and there it is, an inflamed pimple on the chin at the worst possible moment. The cheeks, a zone with several possible triggers. The upper part is traditionally associated with the respiratory system and air quality. People with chronic rhinitis, allergies, and smokers experience breakouts on the upper cheeks more often. The lower part and the area around the mouth, associated with the digestive system. When diet changes sharply or there's an excess of certain foods, sugar, dairy, fatty foods, this is often reflected precisely here. The forehead most often reacts to stress and disrupted sleep. The nervous regulation of the forehead zone is directly connected to the autonomic nervous system. Chronic tension, sleep deprivation, high cortisol, and the forehead begins to develop fine bumps. The nose and nasolabial triangle, the T-zone with a high concentration of sebaceous glands. Breakouts here are more often linked to excess sebum, less often to specific systemic causes. An important clarification. Facial zone mapping is a tendency, not a law. One pimple on the cheek doesn't mean a gut problem. But if the cheeks break out regularly, in the same pattern, and there are other symptoms alongside, that's already information worth working with. This is why it's a useful tool, specifically in the context of self-observation. Not for making diagnoses, but for asking the right questions. Why here again is a better question than, what product should I buy? Because it leads to the cause, not another layer on top of the symptom. There's one more important thing that needs to be said honestly. Zone mapping is a guide for thinking, not a substitute for diagnostics. If breakouts appear frequently, cover a large area, are accompanied by painful nodules or other symptoms, that's a reason to see a dermatologist, not to search for explanations online. Self-diagnosis by facial zones is a first step toward understanding, not a final answer. Now about what actually happens in the skin when a pimple forms, because this helps understand why different approaches produce different results. A pimple is not simply a clogged pore. It's an inflammatory process in the hair follicle. It goes through several stages. First, a blockage of dead cells and sebum, a comedone, open or closed. Then in this closed environment, Cutibacterium acnes, a bacterium that normally lives on skin without issue, begins to multiply actively. Immune cells respond with inflammation. A papule appears, a red, inflamed bump. If the inflammatory process goes deeper, a pustule with contents, a nodule, or a cyst, understanding these stages matters because different active substances work at different stages. That's exactly why one ingredient doesn't solve everything. You need an approach that addresses several links simultaneously. One more practical point. Most people notice a pimple when it's already visible, red and inflamed. But by that point, the inflammation has been going on for several days. The most effective moment for targeted treatment is when only a slight thickening or redness has appeared, before a fully formed pimple develops. At that moment, the right product can stop the inflammation from developing at all. Now, the mechanism. I'll explain as a dermatologist. What exactly happens in the skin with acne and why some people are more affected than others? I'll start with the main question. Why do some people have acne while others don't with the same lifestyle? The answer lies in three factors. Genetically determined sensitivity of sebaceous glands to androgens, the composition of the skin microbiome, and the intensity of the inflammatory response. All three vary from person to person, and their combination is precisely what determines skin's predisposition to acne. That's why acne is not a hygiene issue. A person who washes their face twice a day and drinks enough water can have pronounced acne, while someone who seems to pay less attention to skincare may have none. This is about different sebaceous gland genetics, different microbiomes, different hormone sensitivity. All of this is physiology, not poor skincare. And understanding this changes the relationship with your own skin. Not irritation at pimples again, but curiosity about what's happening inside right now. First mechanism, excessive sebaceous gland activity. Sebum itself is not the enemy. It's necessary. It moisturizes the skin, protects the barrier, creates an environment for a beneficial microbiome. The problem starts when there's too much of it, or when its composition changes. Under the influence of androgens, sebaceous glands enlarge and produce more sebum. In adolescence, this happens in most people. But hormonal changes in adult life, stress, the menstrual cycle, changes in diet, can trigger this same mechanism again. The composition of sebum also matters. With a deficiency of certain fatty acids, primarily linoleic acid, sebum becomes more viscous and prone to causing blockages. Research shows that in people with acne, the concentration of linoleic acid in sebum is significantly lower than in people without it. This partially explains the connection between acne and diet. What you eat directly affects the composition of sebum. A practical conclusion follows from this. Adding foods high in this component, sunflower seeds, pumpkin seeds, sesame, theoretically improves sebum composition. This isn't a fast effect, but as part of a system, it makes sense. Second mechanism, disrupted keratinization and follicle blockage. Normally, cells inside the hair follicle renew themselves, shed, and exit to the surface. With acne, this process is disrupted. Cells stick together with each other and with sebum, forming a plug. The causes, hormonal changes, an inflammatory background in the skin, and also vitamin A deficiency, which regulates the normal cell renewal cycle. Third mechanism, the role of Cutibacterium acnes and inflammation. Cutibacterium acnes is an anaerobic bacterium that prefers an oxygen-free environment. A blocked follicle is the ideal environment for its multiplication. Its metabolic byproducts irritate the follicle wall and activate the immune response. Immune cells release inflammatory mediators. This is the redness, swelling, and tenderness of an inflamed pimple. An important nuance. Cutibacterium acnes is not uniform. There are different strains. Some are pro-inflammatory, others are neutral or even beneficial. Acne is not simply bacteria on skin. It's a disruption of the balance between strains and between bacteria and the skin's immune cells. That's exactly why antibiotic acne treatments work for a time, but become less effective with prolonged use. Pro-inflammatory strains develop resistance. Substances with a different mechanism of action, such as azelaic acid, don't cause this. Fourth mechanism, chronic inflammation as a background state. This is especially important for those whose acne is stubborn, persistent, and doesn't respond to ordinary products. If there is chronic subclinical inflammation in the skin, from a damaged barrier, from aggressive skin care, from chronic stress, then any trigger produces a disproportionately strong response. The skin is already primed, and only a minimal trigger is needed for new inflammation. That's exactly why people with acne so often show a connection to periods of stress. Not because of nerves, but because cortisol directly intensifies the skin's inflammatory response and stimulates sebum production. Fifth mechanism, the connection to diet and the gut. This is what dermatologists used to tell patients. Diet doesn't affect acne. The position has changed. The two most studied factors are high glycemic index foods and dairy products. Fast carbohydrates provoke an insulin spike, which activates IGF-1, insulin-like growth factor. This factor stimulates sebaceous gland activity and disrupts normal shedding of follicle cells. A direct chain from sugar to acne. Dairy products contain growth hormones and biologically active peptides that in some people activate the same pathway through IGF-1. Eliminating dairy in acne-prone people often produces noticeable results. The gut microbiome is also being actively studied in the context of acne. When gut flora is disrupted, systemic inflammation increases, and this directly affects the inflammatory background in the skin. That's why taking antibiotics, a common situation, is often accompanied by an acne flare. The antibiotic kills both pathogens and beneficial bacteria, disrupting the balance. Sixth mechanism, disruption of skin barrier function. This is talked about least of all, and yet it's very important for understanding acne. With acne, the skin barrier is often compromised. Moisture evaporates faster, skin reacts more acutely to stimuli. The anti-inflammatory reserve is reduced. Many people in this situation continue to aggressively dry out the skin with alcohol toners, drying masks, strong cleansing gels. This destroys the barrier even further. A vicious cycle. Drying out the skin to get rid of pimples. The skin responds by increasing sebum production, which worsens the acne. Now for the mistakes. The most typical and the most common among people trying to get rid of acne. Mistake 1. Choosing products on the principle of the stronger, the better. Aggressive alcohol toners, concentrated acids introduced without a gradual buildup, daily drying masks. All of this destroys the barrier and provokes more inflammation. Skin with acne is already inflamed. Additional stress from aggressive products means increased sebum production and heightened reactivity. Gentleness works better here than intensity. Mistake 2. Applying spot treatments to unprepared skin. Many people take an anti-pimple product and apply it immediately after washing to dry, unprepared skin. But after cleansing, the skin has a temporarily disrupted pH and a weakened barrier. The active substance at this moment either absorbs poorly or irritates. The correct sequence: gentle cleansing, toning, or light moisturizing, and only then spot application. The skin needs to be prepared to receive the active ingredient. Mistake 3. Mixing active ingredients that conflict. Retinol and azelaic acid together can cause irritation. High concentration vitamin C and an acid toner at the same moment, as well. Benzoyl peroxide and retinol simultaneously neutralize each other's effects. The desire to use everything at once is understandable. But overloaded skin responds worse than it would to one correctly chosen active. Mistake 4. Squeezing breakouts. An understandable reaction, especially before an important event. But squeezing always creates the risk of pushing bacteria deeper, expanding the inflammation zone, and guaranteeing a post-inflammatory mark. A red or dark spot after a pimple on adult skin can remain for several months. Squeeze once. Deal with the consequences for 2 to 3 months. There is one exception. Only comedones, white closed bumps, can be carefully and properly removed by a cosmetologist. Inflamed pimples, never. The rule is simple. If it's red, don't touch it. Mistake 5. Changing skincare too often. Skin responds to changes slowly. One cell renewal cycle is about a month. To evaluate the real effect of any product, a minimum of 4 to 6 weeks of regular use is needed. Those who change their routine every 2 weeks never find out what's actually working and continue a pointless cycle of experiments. Mistake 6. Thinking acne is only about external skincare. External care works from the outside, but acne often has internal triggers: hormones, diet, microbiome, stress. No spot treatment compensates for a diet of sugar and dairy in a person sensitive to these triggers. Skincare is one part of the system. Internal factors are another. Without working on both, a portion of the effort is wasted. Now, what works? Not one product and not one change, but an approach that accounts for several levels. First, understand your trigger through the breakout zone. Regular pimples on the chin, especially linked to the cycle, a conversation about hormonal background. If breakouts are consistently cyclical and tied to specific days, it's worth discussing a hormone panel with a gynecologist. Sometimes behind this is polycystic ovary syndrome or other conditions that can be corrected. Pimples on the cheeks. Look at diet. Try eliminating dairy products for 3 to 4 weeks, simultaneously reducing sugar and fast carbohydrates. This is an experiment, not a diagnosis. If breakouts decrease, that trigger exists for you. Pimples on the forehead. Look at sleep and stress levels. Try 3 to 4 weeks without screens an hour before bed, with a consistent wake-up time, and see whether the situation changes specifically in this zone. Often, this is enough for a noticeable shift. Second, restore the barrier as a priority. Without a normal barrier, active products work less effectively and cause more irritation. Gentle cleansing without alkaline components and sodium lauryl sulfate. A light, non-comedogenic moisturizer. Yes, even for oily skin. Sun protection. Retinol and acids make the skin more sensitive to UV radiation, which intensifies inflammation and pigmentation. Third, the right active ingredients for specific tasks. Azelaic acid, one of the most studied substances specifically for inflammatory acne. It's antibacterial against Cutibacterium acnes, anti-inflammatory, normalizes keratinization in follicles, reduces post-inflammatory pigmentation. Unlike many other actives, it's well tolerated by sensitive skin and can be used long-term. An important detail about azelaic acid: it works on several levels simultaneously without causing tolerance. This makes it especially valuable for chronic, recurring acne. Unlike antibiotic treatments, to which Cutibacterium acnes develops resistance over time. Salicylic acid dissolves plugs inside pores, exfoliates dead cells, and has anti-inflammatory action. It works at the level of pores, where blockages begin. Niacinamide reduces inflammation, regulates sebum production, and accelerates healing of post-inflammatory spots. Combines well with most other actives. Plant extracts with anti-inflammatory and antibacterial action. Calendula, chamomile, green tea, licorice. Reduce the inflammatory background and create conditions in which the main actives work better. Fourth, spot application at the right moment. Spot treatments are most effective in the early stage of inflammation, when only redness or thickening has appeared, before a full pimple has formed. At this moment, azelaic acid can stop the inflammation from developing. Apply to clean, slightly moisturized skin, point-wise, only on the area of inflammation. Fifth, diet as a complement to skincare. 3 of the most evidence-backed steps for acne. Reduce the glycemic load of the diet, consider eliminating dairy for an experimental period, add foods with anti-inflammatory action, fatty fish, olive oil, greens. This addresses some of the internal triggers that external skincare cannot resolve. Sixth, patience as a strategy. There is no product that will clear pimples in a week without side effects. But with a properly built system, gentle care, the right actives, attention to triggers, the picture starts to change after 6 to 8 weeks. After 3 to 4 months, the changes become stable. The main thing is not to change strategy prematurely, and not to confuse the temporary worsening during the initial period of retinol or acid use with, the product isn't working. The first 2 to 3 weeks, the skin is adapting. This is normal. There's a simple way to track progress. Photograph the skin every 2 weeks, in consistent lighting, from the same angle. This is much more accurate than daily mirror checking, where changes are barely noticeable. After a month, comparing 2 photos gives a real picture. Better or not. Now specifically, about Aravia Anti-Acne SOS Gel Spot Treatment. I'll explain as a dermatologist, not just what's written on the packaging, but why exactly this formula makes sense for inflammatory acne. The main active ingredient, azelaic acid. This is a dicarboxylic acid that the body produces on its own, but in insufficient amounts for a therapeutic effect. In cosmetics, it's used at concentrations of 5 to 20%. Three key mechanisms of its action. First, antibacterial. Azelaic acid suppresses the growth of Cutibacterium acnes inside the follicle. At the same time, unlike antibiotics, it doesn't cause resistance. The bacterium doesn't develop tolerance to it. This makes it suitable for long-term use without loss of effectiveness. Second, normalization of keratinization. Azelaic acid regulates the process of cell division and shedding inside the follicle, the very disruption that leads to blockages. It addresses the cause, not the consequence. Third, anti-pigmentation. Azelaic acid inhibits tyrosinase, the enzyme involved in melanin synthesis. This means it simultaneously reduces inflammation and prevents the formation of post-inflammatory dark spots. For those where every pimple leaves a long-lasting mark, this is especially valuable. Now about the rest of the formula and why it's not accidental. Allantoin, a substance with pronounced soothing and healing action, accelerates tissue regeneration and reduces irritation. Its presence alongside azelaic acid matters. It compensates for possible irritation from the active acid and accelerates healing after inflammation. Green tea extract is rich in polyphenols, primarily EGCG, epigallocatechin gallate, one of the most studied natural antioxidants with pronounced anti-inflammatory action. Reduces the activity of inflammatory factors, protects cells from oxidative stress. Chamomile extract contains azelene and bisabolol, substances with documented soothing and anti-inflammatory action. Reduce redness, decrease skin reactivity. Calendula extract, anti-inflammatory and regenerative action. Helps the skin barrier restore itself in the area of inflammation. Licorice root extract contains glabridin, which suppresses melanin production, enhancing the anti-pigmentation action of azelaic acid. Additionally, licorice has anti-inflammatory action through cyclooxygenase inhibition. Celandine extract, antibacterial and anti-inflammatory action, traditionally used in dermatology for inflamed breakouts. So this gel's formula addresses several tasks simultaneously. The primary antibacterial and normalizing effect through azelaic acid, calming of inflammation through the botanical complex, acceleration of healing through allantoin, reduction of pigmentation through the combined action of licorice and azelaic acid. The format, a spot gel. This matters. Not a cream for the whole face, but targeted spot application. This format creates a high concentration of active substances directly in the inflammation zone without irritating the surrounding areas. How to use it? Apply pointwise to clean, slightly moisturized skin, only on the inflamed areas. Most effective at the very beginning of inflammation, but also works on an already formed pimple, accelerates its resolution, and reduces the risk of a residual mark. One more important point about use. Azelaic acid works cumulatively. This isn't a first aid product for one-time use. The first changes, fewer new breakouts, faster healing of existing ones, are usually noticeable after 3 to 4 weeks of regular use. A sustained effect on post-inflammatory spots, after 2 to 3 months. That's exactly why it's important not to give up after a week and conclude, it doesn't work. Who is this most relevant for? People with inflammatory acne on the chin and cheeks, the most common zones we covered today. Those who get dark spots after every pimple. The dual action of azelaic acid and licorice is especially useful. Those who want a spot treatment without aggressive components. Azelaic acid is well tolerated even by sensitive skin. One last point. A spot gel is not a daily all-over face routine. It's a tool for targeted treatment. That's exactly why the 20 milliliter volume is not small. With spot application, one tube lasts a long time, and the concentration of active substances in the right place remains high. Far more sensible than spreading the product all over the face and causing irritation where there are no breakouts. The link to Aravia Anti-Acne SOS Gel is in the description of this video. Let's summarize. Pimples in the same places are not a coincidence. The chin speaks of hormones. The cheeks are often linked to diet and digestion. The forehead reacts to stress and disrupted sleep. This isn't a reason to diagnose yourself in the mirror, but it is a reason to look more carefully. What in your life and your body could explain exactly this pattern of breakouts? If you look at your face from this perspective, it stops being a source of frustration and becomes a source of information. This is a different conversation with your own body, a more interesting and more productive one. Working with acne is a multi-level process. Restoring the barrier. The right actives for specific tasks. Attention to diet and hormonal background. Patience. Skin changes slowly, but with a systemic approach, it changes sustainably. What to do right now? Look at your breakouts. In which zones do they appear most often? This is the first step toward understanding which trigger is worth working with. If you need a spot treatment with azelaic acid, the link to Aravia Anti-Acne SOS Gel is in the description. Leave a like if the video was useful. Write in the comments, which zone do you most often break out in? This helps me choose the next topics. Subscribe if you haven't yet. The next video will be about post-inflammatory spots, why they stay so long and what actually speeds up their disappearance. See you next time.